right. Happy Get the Lead Out week, everybody. Thank you so much, Michelle, for inviting me here today and to be a part of this event. I'm excited to dive into organizing with community and having community initiatives that help get the lead out, right? And I'm excited to moderate a panel of experts in that field. So shall I begin the moderation?
Yes, the floor is yours.
Is the floor mine, Michelle? Thank you. Thank you.
Yes.
It's tricky virtually moderating. So thank you for that. Again, my name is Gabby Gray, everybody. I am a Pittsburgh native. I am the lead organizer of Pittsburgh United's Our Water campaign. And it's a joy to be here with everyone today as we, really glean from each other regarding strategies of how we can protect our neighborhoods and to keep our homes healthy and safe for everyone. And so, I'll just share a little bit about myself very quickly. First, I got into this work. Like I said, I'm a resident of Pittsburgh, and so I'm a survivor of Pittsburgh lead water crisis. And I remember when there was no water on the shelves, and that was how I found out. It wasn't a necessarily clear message. Oops, sorry about that, you guys. I'm having technical issues. So that's why I'm actually on my phone. I apologize. But I got into this work, again, survivor of the lead water crisis here in Pittsburgh. And in 2019, I was denied my lead line replacement. And so that's what really spurred me into action with organizing with community. And so I ended up organizing and jumped in with the Our Water campaign, and I ended up going through their program, and now I am the lead organizer of the Our Water campaign. So it's been a very unique experience having this 180 where, people who I really, in entities I really didn't see as allies, now, I'm working with as partners on getting the lead out. And so I'm happy to now dive into this discussion with our expert panelists here. Hi, everyone. It's so wonderful to see you all. I love meeting community from other areas in our nation who are doing this work. We have here, I'm gonna just introduce you guys by name, and then each of you can kind of give a background of your work that you're doing. Is that all right? All right, I appreciate that. First, we have Lisa Ramsey, and so great to have you here, Deputy Director from Trumbull Neighborhood Partnership in Ohio. And then we have Janine McMillan. Welcome, Janine. So great to see you, Executive Director from the Center for Population Health right here in Pennsylvania. And then we have Claire Henry, Program Director, Coalition to Prevent Lead Poisoning, as well as Causeway Community Partners all the way in New York. Welcome, Claire. So great to have you here. So we'll start with you, Claire, if you don't mind, just giving us a little background about the work that you're doing in New York.
I can. I think that I have slides, and I'm so sorry. This is another virtual thing. Do we want to do the slides right now, Monica? Sorry. Or should we start with our friends from Ohio? Oh, great.
You can go ahead. Yeah.
Okay, thanks. Hi, everybody. Thank you so much for having me here. Like Gabrielle said, my name is Claire Henry. I am the program director for the Coalition to Prevent Lead Poisoning, which is backboned by Causeway Community Partners. I know it's a mouthful. Causeway Community Partners used to be the Ad Council of Rochester, so we were Rochester's version of the National Ad Council. And though we focus on Rochester, we cover all of Monroe County, New York, which is in between Buffalo and Syracuse along I-90. And I am a native of the area, but I did spend 2 years of my life working on a grad program at Pitt. And I come down to Pittsburgh often because my in-laws live there. So we serve all of Monroe County. Like I said, in the county, there's about 170,000 kids under 18. And our housing stock is overall in the county about 70% pre-1978. And like I said, we focus in Rochester because we have even higher percentage of housing that's pre-1978 in Rochester. It's more than 80%. And much of it is from really like 1800s. The house that I own is built in 1929. And we have a couple of other risk factors in the city of Rochester. 40% of children live in poverty, an estimated 40%. We also see that year over year, roughly 80% of the elevated blood lead levels in the county are kids from Rochester. And they are unfortunately focused in specific zones that have a number of challenges. So that's really where we focus a lot of our efforts. Sorry, Monica, now you can go to the next one. A little bit of the coalition history. We just celebrated our 25th birthday. We were established in 2000 after a spark of a man called Ralph Spezio. He was a principal at a school in School 17. It's on the west side of Rochester. He was noticing in the late 90s how many kids had behavioral challenges, and then somehow miraculously he was able to see in their charts there was a little bit of like digging that he wasn't supposed to be doing officially, but because he discovered that about 40% of his students had histories of elevated blood lead levels. So that's 40% of like his incoming kindergarten classes on average were coming in with elevated blood lead levels. And as we know, in the late 1990s, that was much higher than it is now. So you can imagine how much of a problem it was in Rochester. The original crew it included folks from Monroe County, the city of Rochester, housing organizations, parent groups, healthcare providers from some of our bigger hospital systems, and the University of Rochester, the school district, and the Western New York Lead Poisoning Resource Center, and many, many others. And as I mentioned, we're backboned by Causeway of Community Partners for a number of years. And in one form or another, all these folks are still meeting after 25 years. And I was brought on about a year and a half ago as full-time staff. And so I'm building up programs and other things. Thanks.
That's absolutely beautiful work, Claire. Thank you so much for sharing that. I apologize. I think you guys already may have a pattern of who goes next. Am I right? So I guess I would say Lisa would go next. Would I be correct in saying that, Lisa?
That's totally fine.
Is that all right with you?
Yeah, we're flexible.
Okay, I love it. Go on ahead and just give us a little summary about the work that you're doing.
Sure. I included a map because I'm actually a geographer by education and somehow ended up here. But I like everybody to know that that's where we're at. So we're almost PA, but we're not. So I'm from Warren, Ohio. We at Trumbull Neighborhood Partnership, we're a community development corporation. We serve the entirety of our county with a heavy emphasis on our urban core areas, which is the city of Warren. That's a city of a population of about 40,000. So we're definitely on the smaller end of a city, but the same type of housing structure as you find in most kind of Rust Belt cities. The houses are old and they have lead issues. We are very much practitioners. So we didn't come into this with thinking about lead first. We came into it, how do we improve our neighborhoods? How do we improve the quality of life for our residents? And really the next couple of slides are just going to be examples of how we fell into touch points with issues regarding lead in our community. The first, and these are, I know, super tiny fonts, so just bear with me, I apologize. But these are, we do a lot of housing. We do renovation of occupied homes, everything from small repairs all the way up to full house rehabs. But we realize that that's a limited pool of funding. We do have a lot of houses. Those are clearly that house is constructed prior to 1978. So what do you do if you're living in a home that has some paint issues, that is older? So we created a flyer that has some tips for cleaning. We have a HEPA vacuum that we can check out for free for community members if they would like to use it, just to try to get some of that baseline awareness together while they wait for a longer term solution. Be it that it's, you know, in this instance with that house, it's the siding replacement, all the way up to maybe it just needs to be moving out of that property and into something more safe, which kind of leads us to our next activity, which is on the next slide. We do a lot of demolition over the years, and we realized very early on when we started doing demolition, the first thing community members do is they haul their kid outside to watch the big digger knock the house down. And that's super dangerous for a variety of reasons. But, you know, primarily for the purposes of this conversation, the lead dust going up in the air. Asbestos is abated before demolition, according to Ohio Revised Code and EPA regulations, but lead is not something that is addressed. So there are rules about, you know, wetting the demolition down, but we knew there were some education components that needed to happen. So these are door hangers that we hang on the properties of houses around the demo, just to give some tips to let families know what's going to happen. And we also require some educational components for our contractors themselves to make sure they understand, you know, they go home to families as well. So making sure that they know, you know, changing their clothes and just tips and tricks to reduce the points of contact with potential lead dust. After demolition, which we talk about on our next slide, we deal a lot with what do we do with the land after the houses come down? And the most common would be either green space or passive use projects. So it's just your side lot, it's just your yard, or maybe, you know, there's a little walking path or something like that. We had a lot of community members buying those side lots, and we had a lot of community members wanting to do small projects. So we created this guide. This was actually in collaboration with the US EPA grant to create a guide, again, with just tips and information and ways to interact with that land in a safer manner. Knowing most people aren't going to go out and do a full-blown, you know, lead test, and they're not going to replace all the soil on site. So how do we interact with that new land post demolition in a safer manner? And then the last way that people tend to come into contact with that property is gardening. And so gardening is especially tricky because now you're growing in the ground and you're pulling food out in soil that may or may not be contaminated with lead and, you know, goodness knows who, whatever else. So we put this together because we do have a number of community gardens and we have a nice home gardener community here. So how do you more safely grow your fruits and vegetables? Because we certainly want to encourage that, but how do we do that in these spaces that have potential contamination? And so again, these are all very, you know, high level examples, just real fast, of things that we do when we're talking to our community members and we're doing our programming, and how we've kind of drug that conversation of lead along with us, because it is a massive issue in our community as well as yours. And it's definitely under acknowledged and very much not understood in most communities here. So just very fast, but wanted to touch with those. And I can already see, I'm sure there's questions. I can definitely share content. It's good. It's way too small print, but we definitely share.
Oh, that's wonderful. Thank you so much, Lisa. And Janine, might we be able to hear a summary of the great work that you're doing?
Good afternoon, everyone. My name's Janine McMillan. I'm with the Center for Population Health. I think Jennifer mentioned all the Pittsburgh connections. My mother was born in McKeesport, and my daughter's a grad student at Duquesne, so go Pitt. Just to give a little bit of a context, our community is, I don't have a map, but our community is located kind of smack dab in the middle of Pitt and Penn State country. We cover both Cambria and Somerset counties here in Western Pennsylvania. And we're a little bit early on in our journey. Our lead task force was created about a year and a half ago now, really as an outgrowth. And I saw some familiar names on the chat there, but really as an outgrowth of one of our nurses through the UPMC health plan, Sarah Rearick, is on the call here, really kind of raising the flag, raising the red flag, and sharing that, you know, they at the pediatric offices that she works out of had been seeing such an increase in the number of children who were testing not only for high lead levels, but testing with very high numbers. And so we pulled together many different folks. This is just a sampling of the agencies that participated in those early conversations, really just trying to develop a game plan. You know, what can we do? What do we have within our toolboxes with regard to outreach and education to the community, and then ultimately, you know, mitigation as well. Next slide, please. So just a little bit of a background on some of our local data here. The lead paint is the primary cause of lead poisoning in Cambria County. 83% of the rental properties here were built before 1980 when lead paint was banned. In Somerset County as well, the median year for built homes being 1960, with over 14,000 homes built before 1940. Put it into a little bit of context there. Somerset County, the population of the county in total is about 80,000. So I think that puts into context a little bit of how old our housing stock is here in our communities. More than 100 cases of lead poisoning are reported each year in Cambria County, with only 1 in 5 children tested. So not only do we have this very old housing stock, we know that so many of our children just are not getting the testing itself that is so essential in identifying the issue. Next slide. So really just some high-level bullet points of some of the work to date. Again, that development of the local committee comprised of so many individuals, our health and human service agencies, our landlord association, the housing authorities, water authorities, Rockstar, Pennsylvania Department of Health nurse, and our community city officials. I think Lauren Lazari is on the call here as well today. Lauren is an early childhood systems coordinator for Cambria and Somerset County. It's a newer formed position. And Lauren, along with Sarah and so many other folks in the community, have done an incredible job of really taking that education mantle out in the community. So going to all of our health fairs and education events in the community, any diaper banks, really just making sure that anywhere that we had a captive audience of folks to provide that education to. That's why I said, Lisa, would love to see all of your materials and see where we can maybe rob and deploy a little bit and learn and share with each other. So again, just so much work over the past year has gone into that general education. But for as much work as we've done, one of the barriers, the significant barriers, is funding for mitigation. We just don't have, you know, so we're providing that education and resource information for the families, but when it comes down to that mitigation that's needed, funding is definitely a barrier. So through the efforts of, again, that local task force and community, we were able to work with the Cambria County Redevelopment Authority to support an application for the U.S. Department of Housing and Urban Development, the HUD Lead Hazard Reduction Grant Program, and Healthy Homes Supplemental Funding to do the bullets that you see on the screen there. So not only a focus on increasing the number of children that are receiving that blood level testing that you saw on the last slide. We've got a lot of work to do there to try to get out in the community and provide this information to encourage that testing. Being able to provide funding and mitigation opportunities for not only the homeowners, but our landlords as well, who are doing the best that they can. And many of them do not have funds for the remediation as well. From a workforce development standpoint, there were quite a few contractors who were certified in lead abatement previously, but when that funding went away, a lot of those folks let that certification lapse. So being able to support through efforts with one of our local agencies, training of small businesses to become certified lead abatement professionals is another opportunity that we see. And again, continuing that education throughout the community on how to identify and mitigate those lead paint hazards is definitely another priority focus area. I think that's all of my slides. And a beautiful picture of the Somerset County Courthouse. Gabrielle, we can't hear you. You might be on mute.
All right, can you hear me now? Okay, great. Sorry about that. I don't know what's going on, you guys. Bear with me. I'm going to moderate. So what I was just saying is thank you, Janine, for that wonderful summary. And thank you, Claire and Lisa, for those summaries as well. I'm learning so much already about the great work that's being done. So I guess let's dive in, right? We have some questions. And this first question is for, will be Janine and Claire. And I have here, what has the most effective strategy your city or county has implemented to prevent lead poisoning, whether it be policy, a partnership, community engagement, and what has made it successful? So I guess, Claire, if you don't mind, you want to jump in first on that?
Sure, I'll go. So caveat is that this happened 20 years ago and I was not around. There are several people who are still on the coalition who remember this, but it was a great thing, but it happened 20 years ago, so I'm not taking any credit for it. But by far our most effective strategy has been the Rochester Lead Ordinance, which passed in 2005, was implemented in 2006. So it's also the 20th birthday of the Lead Ordinance. This ordinance tacked on a lead inspection, like a lead hazard inspection, as part of the already in place certificate of occupancy process. So the rentals in the city of Rochester since sometime in the 90s, I believe, have, or maybe even farther back than that, rentals other than owner-occupied rentals are required to have a certificate of occupancy to operate legally. And the lead inspection that's part of our certificate of occupancy process includes a visual inspection, both inside and out, for deteriorated paint, and bare soil in the drip lines of the home and any outbuildings. And in the high-risk areas, so those are the areas that I mentioned earlier, there's several zip codes where proactive dust wipes are taken throughout the unit. And if you fail your visual inspection, they will also do a dust wipe. But they're not going to do proactive dust wipes in the non-high risk area. And the high risk area can change based on the county's data of where the elevated blood lead levels that are confirmed, and they can find a building that is causing the elevated blood lead levels. So they change slightly, but unfortunately not as much as we would like to. So in the early 2000s, childhood lead poisoning rates in Monroe County, in the 10 years after the implementation of the lead ordinance, the lead poisoning rates in Monroe County decreased at 2.4 times faster than any other county in New York State. And that is a result of a combination of factors. It's not just the lead ordinance, but that is obviously one of our biggest successes, and it continues to this day. We've got the lead paint program at the City of Rochester that both does the inspections, and they're part of the rest of the code group. So there's the lead paint program coordinator, Albert, who has a whole new crew, which they're just there to do lead inspections, and they are awesome. They just started in April. So it's been successful because there was definitely some luck. Back in 2005, we had the right mayor and the right combination of people who were just like, yes, we want to do something about this. This seems like the most effective and attainable way to try to address this environmental justice challenge that we have in Rochester. So it's relatively simple, it's relatively low expense, and that's what makes it attainable. The state of New York has, it's not implemented yet, but the law has been passed. We're waiting for the regulations. The state of New York has made this statewide. So there's going to be state rental registry that is modeled after the Rochester model. One thing that I didn't mention is that we do have all of this information publicly available, so you can look up your address and see when the last certificate of occupancy was issued, and so you can assume that the lead inspection was done, and you can see the service line, all that good stuff.
Amazing. Congratulations, New York, right? And I love, the part where you said, it actually is working and it's statewide, right? They saw
It will soon be statewide. So we have the law was passed. The Department of Health has been working on the regulations, and they're supposed to be out anytime. So we'll see. Well, in a couple of years, you can ask me how it's going statewide.
I love it. I love it. Excellent. Exciting. Janine, would you like me to read the question over again, or are you able to answer?
I can answer, I think, just from a most effective strategy position, I guess. I do want to share, Claire, I just, I'm thinking 20 years from now, you're 20 years in your journey, looking at our community, really just kind of starting on this journey of that community collaborative model. I'm excited to see where we go and what we're able to accomplish. And I think just, from a most effective strategy to date, again, we've been, haven't been much long in our journey here with that collaborative work, but just the development of the task force and the ability to bring all the folks to the table, I think has been a really great success. I've learned so much in the process. I'm listening to you all and taking so many great notes because I'm still learning so much. And I think, having so many subject matter experts at the table, whether it's our clinical providers, outreach coordinators, folks, from our city, our water authorities, truly has been just so helpful in really determining what we're able to do collectively. And the fact that, we were able to kind of rally everyone together to also apply for funding. So fingers crossed, we'll let you all know if anything comes of that. We also recognize that with or without funding, we still need to continue to move forward with the education, with the outreach, and providing any resource information and materials that we can to folks in our communities. So I think, yeah, that's just been, I think from our journey perspective, just the ability to bring everybody to the table has been really incredible.
Beautiful. I love it. It's nothing better than community coming together. That's the best. That's the most sustainable way, right? I guess we can jump to our next question, and I'll position it for you, Janine, to answer first. Are there any community outreach efforts that you have found most effective in raising awareness about lead poisoning?
I think a couple of things. One, we have a very, very dynamic leadership within our landlord association and our housing authority. And early on, they were able to bring together all of the folks that are part of that landlord association and open up an educational session to folks in the community to learn more about, again, the issue and what they could do as local landlords. And I think they were able to bring the local Department of Health nurse who was able to provide that education. We're talking about, another event this year so that we can continue that ongoing education. So I think that's one area, I think, from a community outreach standpoint. And, again, I think, as I mentioned, we are very blessed in our community to have an early childhood systems coordinator who is focused on all things early childhood related. So not only looking at some of the barriers with regard to, education, support services, early intervention programs, but also being able to, for her to be able to pivot and really kind of focus some of those outreach efforts and education on lead has been, really a great opportunity. And I know that not a lot of communities have that as a resource. So I think for us, we've been very blessed to be able to have someone in that position that's waking up every day, just thinking all things early childhood related, and whether it's outreach or education.
Beautiful. And then Lisa, same thing. Are there any community outreach efforts that you have found most effective in raising awareness about lead poisoning?
Yeah, absolutely. This is the one I feel like most people are going to dread because it's definitely labor intensive, but it is one-on-one conversations. It is conversations at the door. Somebody who, that's why we have the door hangers, talking to them about what's going on with the property next door, what's happening with their own property while you're on the front porch, talking with them and seeing like, oh, there's paint chipped up all over their own front porch. We've found that a lot of community members, they'll shut down. I think if you kind of come at them too quickly with, and you're poisoning your children, because lead's so tricky. It's very invisible. It's not like you get a rash and it's immediately obvious what's happening. So we tried really hard to come in with the more like casual, but like, here's some very simple things you can do: washing your hands, checking the paint around your windows. And then kind of moving into, have you maybe consider asking your doctor to check your child's lead levels? Just those types of, they're intensive because it's one-on-one and they're not fast. But they are extremely effective because we're finding that most people just glaze over when the cute graphic goes by on social media. Wherever we can, we do also do the tabling. Every outreach event we can possibly get to, we're there with a whole bunch of information. And again, that even there, it's just having that conversation with somebody about the really practical, do your windows have peeling paint around them? That type of entry is super easy and clear to see. But that's been probably our most effective manner of outreach. And we've tried a range of others, but that's by far labor intensive again, but definitely produces results.
I love it. It's very important, especially because there can be barriers to mitigating lead, and they can be costly, right? And sometimes just not feasible, especially for people to go out of their way for something that's invisible, right? You're asking me a big ask right there, right? So I love it. I love that. I guess, Lisa, have you had any failures in your programs, and have you learned? I'm sorry for that. I'm back. But have you had any failures in your programs, and have you learned any lessons from these failures that have changed your approach?
Yes. So we were very fortunate last year with the remaining ARPA funds that the state of Ohio had. They created a very large program. It was a one-off called Lead Safe Ohio. And in that, they released a substantial amount of money to do lead safe repairs and lead abatement in houses throughout the different counties. And the time frame for the turnaround of spending on the funds was extremely quick. So we immediately reached out to all of our partners and said, tell us everybody, give us every address you have of a household that has a child in it that has elevated blood lead levels. And it was crickets. I received 4 addresses. So then we're like, okay. So we actually called every superintendent of every school district in Trumbull County, which amounted to, I think, a couple dozen phone calls, talked to them and said, can we send a survey out to your students, because everybody's now on these digital platforms, to their families to see, if they might, and it was very simple questions. Do you have, peeling paint? Are you an owner of your house? Do you have any children? Just very simple questions. And we received 20 responses countywide. So that was a spectacular failure on both counts, just realizing how that method was just not going to work, especially in the turnaround time that we had. And then that's when we pivoted to those, let's go have conversations with people. And we walked down streets of houses that age met the requirement, that visibly outside you could see there were issues. We started digging deeper and just asking, we talked to our Head Start locations to see if they had referrals, and we cobbled it together by the end. And of course, the way things work near the end, that's when people started to catch on and the funding ran out. But we're using those lists to distribute our other information, but also to use that as advocacy. Now we have data to go back to the state and say, we really need this funding. This is how many households we're starting to see. But I will say that was a shocking failure when we started the program, when we realized we were getting absolutely no feedback, no names. It was wild. So definitely learned from that one and had to change up our approach pretty quickly.
Absolutely. Interesting. And I guess this next question, Claire, are there any specific partnerships that have had a big impact in your lead poisoning prevention efforts? And do you have any advice for others trying to build a similar partnership?
We are so lucky. We have many good partnerships, and we've had them throughout the last 25 years. And like I said, I've only been here for a year and a half, so I feel like I can't take any credit for any of these, and I'm not sure if I am the best person to give advice. I was maybe going to have jury duty today, and so the person who was going to maybe take my spot has been with the coalition for a lot longer, and she actually works at the University of Rochester Medical Center, which is the partnership that I wanted to lift up. So I was going to make her brag about the partnership with her organization. They've been a vital partner since the beginning. That principal that I mentioned way back when, so he was able, through some of his connections at the University of Rochester, which runs our largest hospital here and is one of our bigger hospital systems, just like UPMC, it's the URMC here, they were able to get some of that information about the kids with the elevated blood lead levels to inform how they went forward with the things that they did at the school. So it's been since the beginning. And they have the University of Rochester houses multiple entities, including the Finger Lakes Children's Environmental Health Center, which is both somebody who helps fund our work, but is also a vital partner on not just lead, but all things children's environmental health in the area. And then the Western New York Lead Poisoning Resource Center, which provides a wealth of expertise. They are the ones who do the chelations for not just kids in Monroe County, but all the way down to Pennsylvania in like Steuben County, down in the southern tier. Kids will come up to be chelated here in Rochester. It's right over there. I know you can't see it. And so they provide expertise and advice to me and my other colleague who works on lead stuff. And there's multiple pediatric practices that are underneath University of Rochester Medical Center. And then we also have the Environmental Health Services Center, which is properly university, not medical. They also provide expertise and guidance and a wealth of data to inform prevention efforts. Research on lead has been happening with University of Rochester professors for decades. So it's really been a huge partnership. And of course, the pediatric practices do treatment and testing for kids and adults with lead poisoning. And I wish I could give you more advice about how, but I guess I always say persistence, like nice persistence. I'm not very good at being pushy, but I can like be like, hey, just continuing the conversation.
I love it, Claire. Thank you so much for that advice. And I'm looking in the chat here. I do see a question here about, can you tell us a bit more on the use of a HEPA vac for lending out? Is there education on disposal of HEPA filter, or assuming agency takes this on?
Yeah.
Who would like that question?
That one I think goes to me mostly because that's our lending program. We do take that on, but I think a couple of points down, someone had commented in the chat, like a really nice explanation to kind of how that works with it. But we don't ask anybody in the community to deal with any of the innards of the HEPA vacuum. We leave that to our staff to deal with. But there's a really nice explanation in the chat.
Thank you, Lisa. I think I'm not exactly sure. It says Janine mentioned drop off and available lead paint. Contractors should code enforcement regulate contractors to incentivize them going to lead paint remediation training. Proactively looking for contractors creating lead hazards when doing renovation, repair, painting activities. Should code officers take the EPA lead safe work practices training? I'm not sure. I see Janine, you went off mute for that one. You want to?
Yeah, I was just going to say, and Claire and Lisa may have more information, but I do know one of the largest city in our 2-county region. I know that the city code enforcement officers do have that training, and they are actively seeking additional folks for that as well. I think, for us, really just wanting to have a greater pool of contractors that could be pulled from in order to do the actual mitigation is another one of the other goals. But Claire, at least I don't know if you have anything additional to add for your community.
I'm not sure what the code officers in Rochester need to do, but anybody who is a landlord is supposed to have RRP training, and our county does, when they are able to, offer free RRP training courses. So the initial 8-hour one. And then there's a couple of local folks who offer them. You have to pay for them.
Thank you, Claire. I think we can now, I guess we have some more time. We can open up. I don't see any more questions in the chat. If the audience has any questions, let's see. You could put them in the chat or raise your hand. I see here. Does part of your outreach include, this question is from Donald, does part of your outreach include talking to women of childbearing age, mothers with newborns, adults at risk, chronic lead exposure? Are there barriers to participation in your programs? Are public housing included in your programs?
Yeah, I guess I'll just chime in here. I think yes, anyone that we can share this information with. We are very blessed in our 2-county region. I guess, kind of a blessing and a curse. The blessing is that we have an incredible number of health and human service agencies that are very engaged. The challenge is there's a reason why we have a lot of health and human service programs and resources, because the need in our 2-county region is so great. I guess, yes, to answer your question, the outreach is focused on our vulnerable populations, which does include, pregnant individuals, new mothers, and others that, again, are at risk. And we have a very engaged housing authority. And I think it's another opportunity for education to the community, because I think with our community, there is a stigma when it comes to the housing authorities in Section 8. And one of the things that we've been ensuring to communicate is that when there are Section 8 properties, they have a rigorous set of standards that landlords have to follow. And one of those is that testing and making sure that there is not the presence of peeling paint and lead in the homes. So there's definitely that educational component. And like I said, we are very blessed to have a very engaged housing authority community that are involved with our task force.
Thank you for that, Janine. Appreciate that answer. I do see someone asked, would you be willing to share your door hangers?
Yeah, absolutely. I'll put my email address in the chat box, and feel free to reach out. And if you have suggestions on improvements, we'll take that, because like I said, we're coming from the doing work in the community, not from the medical lead perspective. So we ask everyone and their mother, how can we make this better? So I'll put my email in now.
Thank you so much, Lisa. I appreciate that. I agree. As a community organizer in water, which is very complicated in and of itself, right? And then you're going to put lead into the equation. It can become very overwhelming. And, when you're overwhelmed, a lot of times it's just easier to kind of ignore and compartmentalize things differently. And so your story was very interesting, Lisa, when you said there was like 20 people who responded across the entire county, right? And that just really goes to show the importance of education, right? And how it has to be, really prioritized, essentially for this work to really get done sustainably, right? And in particular, for regions that may not be as connected to nonprofit sectors or, communication, information flows, these kinds of things. Because that's what happened where I'm from. I'm in an environmental justice community, right? But none of us knew what environmental justice was. I just knew I needed my lead line replaced, and I wasn't paying $30,000 for it. And I thought it was an isolated problem that only poor Gabby had, right? I'm impoverished. This is a poor people problem. And little did I know that, no, this is a national, international problem. And so, that's where organizing our voices together so that, like you said, familiarity really helps get through some of those barriers. People often will listen to Gabby, right? Because I'm their neighbor, versus Allegheny County Health Department or something, all extra official government, agency. Because some people think that when the government steps in, well, maybe, I have to protect my living situation a little bit more tighter, right? They kind of do extra to, block out the assistance. So it's really critical that we all work together across the entire nation, right, to make sure that we're reaching everybody we can, to get the lead out and make sure that the children are living lives that are in healthy homes and in healthy schools, and so that they can flourish. So this was great, everyone. I don't see any other questions. And with that, I guess we can end this part of the presentation. Thank you so much, Claire. Thank you so much, Janine and Lisa. You guys have been fabulous. And I look forward to building more community with you all.
Thank you.
Thank you.